we're very happy to have this session. As you know, France is a great country for strikes as well. So we are hoping that Mélanie will join us during the panel. So don't be surprised if Dr. Mélanie Autran is joining us as we speak. So we'll be very happy to do that. So I'm Pierre-Antoine Gourraud. I'm running the biomedical data warehouse at Nantes University Hospital with over 3 million patients. And I'm also running a project in multiple sclerosis in particular, where we are looking at the outcomes of patients based on various therapeutic scenarios, which is basically all this idea of value-based decision and value-based healthcare. So we're talking about AI. That's really the theme for AI for health. In this session, we are going to talk about what we hear from the previous session, that value is very important. And in value-based healthcare, it's really an emerging type of models where healthcare providers are actually incentivized based on patient health outcomes rather than the cost of the service that is delivered to them. So we'll stress on the potential of how this would transform care delivery, but the question is really how we're going to get there. And for that, we'll ask Nienke Feenstra from Takeda to actually show us first the vision of how does it resonate for pharmaceutical companies like Takeda.
For us, it resonates extremely strongly. We want to partner to contribute to a more sustainable healthcare system, that it starts with value-based healthcare. On a global level, for example, Takeda has, with Medtronic and BCG under the aegis of the World Economic Forum, started the Global Alliance of Value-Based Healthcare to drive the thinking around it, to make sure that we do that together. But it's not just talking about it that makes it happen, of course, and that's more bottom-up in the countries, and their pharmaceutical companies leverage the knowledge they have of the patient journeys to see where do we have a real need. That can be on diagnosis in the field of rare disease, for example, and patients living with a chronic disease. How can we accompany them optimally during the patient journey? And a starting point towards value-based healthcare could be an outcomes-based agreement in the type of chronic treatment, for example. Does the patient stay on treatment, yes or no? And depending on that, adjust the way the financing is being done for a specific medication. That's a very small step, but in healthcare systems that are completely structured and organized for a long time, we have to start in small steps to, in the end, make meaningful change happen.
Thank you very much. What about you, Mélanie? Amel, how does it resonate for smaller companies that are really driven by innovation?
I think we need to be part of the challenge and to address it together with large-scale companies and governments. So at Caresyntax, we have a mission and vision to make surgery smarter and safer. So on the smarter approach, we're like a lot of other tech companies. We're driven by AI, driven by innovation, but on the other side of our mission and vision is really make it safer. So how can we really address that safe space for the patient? And this is why we have actually tried and started including the value-based healthcare models into the way we address the solution to our providers in the hospital. And definitely when you look at that, as a tech company, we're looking at data. And I think we've all understand at the panel that was just before, how data was valuable and important. And on our side, we're looking at data from a surgical space, and we're trying to unlock the silos within the hospital to make sure we can create a pathway instead of just a solution driven only by the technology.
So thank you very much. I think that would have been very interesting to talk about what this notion of data and how this is becoming more and more important. As the one we were in the data clinic in a hospital, where we take care of all the secondary uses of data. I think the question is also becoming very important for insurer, and that's where what we've been discussing a lot with Mélanie is actually how data that have been very important for all the reimbursement system and all the collection. And Marguerite Cazeneuve was talking about how we have this great national system with medico-administrative data. What's interesting here, even for insurers, is that the fact that we are talking about value-based healthcare actually drive the attention to actually what the patients are saying, and that's where patient-reported outcomes are extremely important, even for insurers. And that's an emerging type of data that actually creates the value that is important for insurers and patients alike. So that's really a new type of data that also is becoming important for insurance company, including Relyens and all these players in the field. Mélanie, I'd like to give it back to you because that's kind of a new model, in particular for innovation for companies. There's clearly a risk that you have to accept when thinking about this new financing model for innovation. I'd like to hear more about that and how do you interact with insurers? How do you drive your own innovation with that new type of risk? And there's already a lot of risk in innovation. So, what do you think?
Yeah, there are a lot of risk, and what we're trying to address is not how to, it's really how to manage that risk. We don't claim that with technology or by gathering all the data in the right places, we're going to remove the risk. The risk will always be inherent to what we do. Our core business is based in surgical spaces. So I'm not going to tell you that surgery will be 100% safe, but having the patient in the center, making sure the providers understand that the reason why we want to bring technology into the decision processes, understanding that the data we get from prompts, you were talking about prompts and prems, obviously, is important, which really makes us sure that we all need to be in that space, and we are actually going for what we call risk-sharing models. I won't say it's applicable yet in countries like France, but it's moving forward. But we have deployed such things, of course, in the United States, where Very Base Kit is already part of their scheme. But other countries that we are learning from, like Germany, have already implemented those quality contracts, where obviously insurance companies or companies like Relyens, actually, could have really started innovating in that space and taking the risk together with tech companies and hospitals.
And would you insist on the multiple stakeholders? So we talk about patient, insurers, innovation, care institutions, maybe the patient association themselves. They're very vocal about how we should move toward this kind of systems. Is that all the actors you're interacting with?
Absolutely, and we have no choice, actually. We have to include each of them within this risk-sharing model. And now that we have deployed such solution, we are 100% sure that the data and all this gathered into the same place can really support insurance providers, actually, to start bringing new solution to their market, to their own market. Because we were really based on a very old modeling where we knew what were the risks, and then we were taking those risks as insurance providers. Now the insurance providers want to have the patient actually in the center and say, how can I help you more? Of course, to get more money. Let's be transparent with that. But that's part of the equation. We need money as tech companies. Government needs money to be reimbursing it. But at the end of the day, if we manage to have the patient outcome better, I think all the parties are winning.
Thank you very much. So, Nienke, this is quite a complex topic. We've been talking about money and financing, it's very important for driving innovation. But is it a little bit more than that? And how do you see that at a pharma company level?
It's all about value in the end. We need to make sure what is the biggest value a patient needs along their patient journey, and do that in dialogue with patient associations or patient experts and all other stakeholders around the patients, and then define what is the first part of value where we can really in a meaningful way increase, where we have the data to support indeed financing models based on the value that come there. That is not an easy journey, because it will ask a lot of people to come together in a different way than before. In a fee-for-service model, it's quite straightforward. I provide this drug, this doctor does this intervention, everyone gets paid for that. If in the end we all get paid in the ultimate outcome of a patient, whether it's overall survival or whether it includes indeed prems or proms, like well-being, being able to function in daily life again, how do you split that? How do you do that? That's also where artificial intelligence comes in, through the possibility to analyze that and determine something in a way that will be fair for everyone. But it's also thanks to digital solutions that will allow us to follow those proms and prems along the patient journey. And that can then feed into those artificial intelligence tools that define that value, and in the end make sure everyone gets what is a fair contribution of their part in that value generation for a patient. So it should be all around the patient value, in dialogue with all stakeholders in care. But that won't go easy, that will be step by step. So it's really about thinking big, but starting small.
Thank you very much. So before giving each of you a conclusion word, I think it's resonated for me a lot. As a professor trying to train the next generation of caregiver, and it's very important also that we train them in that direction. That value-based healthcare is not only about the difficulties we have to organize the system and make it happen with money. It's also about how we make room for patients. Obviously, outcomes that are centered on the patients, centered on the specificity of their medical condition, and certainly a one fit for all kind of treatment is certainly not, at least our definition of precision medicine or patient-centered medicine. But that's also mean that experience outcome for patients really matters, and our next generation of caregiver really have to have that in mind. So at the end, again, it's a question of education during the medical and the caregiving training. So maybe one last word for you, Amel, and Caresyntax.
I think we should be thanking you, actually, because I do agree that education of the next generation is a must if we want to have all those parties sitting at the same table and understanding each other. Because today what we see is that we still have reimbursement bodies, insurance company, health tech providers, IT deliverers, startup, very innovative startup that do not understand each other and that still creates silos. So we were talking about risk. I think the risk we need to take today is the risk on innovation, the risk on usage of the data. We might make mistakes, but I think we learn from the mistakes, and this is how we're going to get faster in the delivery process.
Thank you. What about you, Nienke?
Seeing that we have a bit of time because we're one speaker down, I'm going to take the freedom to give some examples as here as well and say, how do you indeed then reduce risk? It again comes back to thinking big but starting small. You will not necessarily have all partners in the healthcare system behind the same objective from day one, but you can, you can start. For example, between, in our case, a pharmaceutical company and a hospital, when we have a tool that allows for a better prediction, this patient will react well to this drug and this patient not, to move to personalized medicine with such a tool and make sure that the financing is based indeed on all those patients that react well to that certain drug. Those are initiatives that we're doing in the field of inflammatory bowel disease, for example. You can start with examples where you use artificial intelligence to speed up diagnosis in the field of rare diseases, where it can take up to 10 years for patients to be diagnosed, and use all the data that are in different hospital records to together come to a faster diagnosis because the algorithm allows to diagnose more. Seeing that Mélanie is here now, I will, however, stop there by giving her the opportunity to share her view as well herself.
Thank you very much. Very sorry to be so delayed. So I speak in name of Relyens. Relyens is a French medical liability insurance company which is executing his work in all Europe. Our specialization is to work on risk management for public and private healthcare institutions. And so we develop partnerships, for example, with Caresyntax. To work on risks for surgeons mostly, but we have a small partnership with PromTime. PromTime is working on prems and proms. I guess everybody heard about it just at the time. So, well, everything has been said. So, if you want, if you have questions at the end of the meeting, you can come to me. Thanks.
Thank you very much to all of you, and we're looking forward to see more of these steps, more of this interaction about value-based healthcare and how this will be transforming in the coming years. Thank you so much.
Thank you.
Thank you.